Hi, Paula. Hopefully this is helpful. I wanted to just do a quick recording to show you the differences between the plans. There are three different plans available to you. One is a traditional plan, meaning that there are co-pays involved in the insurance coverage, and the other two are high deductible health plans. Um, the main things to look at with each of these plans, you're going to see a select tier and a standard tier. So these two different columns just mean what to expect in coverage based on the network or the providers that you're visiting. So the select tier is going to be a more advantageous network of providers for you to visit because you're going to have to pay less. If you are able to visit a Health Partners or Park Nicollet Clinic or Children's Hospital of Minnesota, those are all going to be covered under this select tier. So you would expect to pay these amounts for any covered services. If you are not visiting a Health Partners or Park Nicollet Clinic or Children's, you would be most likely in the standard tier. So it's a slightly different network of providers. And then with that, you pay more for the services provided. So that's really the difference in these columns. And then the deductible is maybe the word that you were confused about. What the deductible is the amount that you will pay in either of these plans before your insurance starts paying for things. So if you elect insurance coverage, this deductible amount is what you could expect to pay towards services provided, even if your insurance covers them. So let's say, for example, you went in to have an annual preventive screening. So your annual normal doctor checkup is covered at no charge to you. But if you had some lab work done, so that would be a diagnostic service. So let's say you had some blood work, some blood taken and some lab work done on that just to test your blood and make sure everything is healthy. That diagnostic will likely come with a charge. And so what will happen is you as the member will be responsible for let's say, for example, the diagnostic costs $800. You would be responsible for paying 100 because that is your deductible. Then your insurance kicks in on the remaining 700. So you would pay 30% of the remaining $700 after you've already paid your deductible. So the deductible is the first thing that you will have to pay for any covered services before your insurance kicks in. The differences in these numbers, this is for if you are the only person covered on your plan. The second number here is if you have a spouse or any children enrolled on your plan. So regardless if you have just your spouse or your spouse and your children or just children, you would pay this $300 deductible. If it's just you on the plan, it's a $100 deductible. Keep in mind, these deductibles are if you are visiting a Health Partners or Park Nicollet Clinic. If you're not, you could expect to pay $1,000 for yourself or $3,000 for covered dependents on the plan if you are, again, visiting an out-of-network provider. So the deductible is what you can expect to pay upfront if you do need any services. Keep in mind your annual visits are not going to cost anything. The copay is a flat fee. So if you are visiting a primary doctor, you're going to pay $10 as long as it's at a Health Partners or Park Nicollet Clinic. If it's not, you're going to pay $60 per visit. And this is just to go to the office. This is not including any additional treatments that might be provided during that visit. This is just the visit copay. Hopefully that helps a little bit. Again, the coinsurance is the percentage that you are paying after you have paid your deductible, and then the maximum out of pocket is the maximum amount you could expect to pay for services that have been rendered. So let's say, for example, you had $8,000 worth of services provided to you throughout the year. You would pay a maximum of $6,700 for those services. Um, if you are a single on the plan, if you have family members on the plan, you would pay a maximum of $13,000. So again, in that example, if your bills are at $10,000, you would pay a portion of the coinsurance on that $10,000 bill because you haven't reached your out-of-pocket maximum yet on a family plan. So the other two plans are high deductible health plans, and what that means is these plans make you eligible to elect a health savings account. A health savings account is an account, and I'll put this in an email for you, but a health savings account allows you to save money before taxes have been taken. So it's tax exempt money. No taxes are taken on these earnings. And you're able to take them and put them into the savings account that's specifically used for healthcare expenses. So it could be maybe you have a co-insurance payment that's due to a doctor. You could use your HSA funds towards that. You could use the HSA to buy even things like sunscreen are covered medical expenses under that health savings or HSA account. So this high deductible plan, again, the deductibles are going to be higher, just like it sounds. This is the amount that you would pay as a single on the plan. This is the amount you would pay as an individual with either a spouse and or children on your plan. Now, keep in mind, this is only if you're using the plan, if you're using the benefits. So the premiums are what you will pay regardless if you use the plan or not. The deductible is what you're going to pay anytime you're using coverage. So you're visiting the doctor, you're having a surgery. This deductible is the amount that you are going to pay before your insurance kicks in. So on this plan, you can see that the deductible amount is higher, but the amount that you are paying towards those services after you have paid your deductible is much lower. So for example, if you know that you have a surgery coming up and it's going to be, we'll guess, $12,000, it may be a good idea to elect a high deductible plan because while you will pay, the $4,500 towards that service, the remainder of that cost will likely be covered by insurance. So really depends on if you have dependents on the plan and what you're going to potentially use the plan for. But as Mike had mentioned in the meeting, the out-of-pocket maximum is another important piece to look at because this is the maximum you could expect to spend regardless of how much you use the plan. So again, in that example, if you know maybe you're having a baby or you have some expensive procedures coming up, this out-of-pocket maximum is the most that you could expect to pay when you're covered on this plan and you're visiting a Health Partners or Park Nicollet provider. And then this is the maximum you could expect to pay if you're visiting other providers. So again, if you have dependents on your plan, you're looking at this $9,000 deductible and $9,000 annual maximum. So hopefully that helps to explain. There are two different high deductible plans. This non-embedded plan means that if you are on a family, you have family members on your plan, you are going to expect to pay this deductible amount versus the single. So that's really the main difference. But these are the deductible amounts on this high deductible plan. So it is much lower than the other plan. But again, know that if you have dependents on the plan, you will need to reach this $3,500 before your insurance will kick in on those additional services. So hopefully that helps. I will send an email as well, and feel free to just give me a call if you have additional questions, and we can definitely talk through everything.